Guys, we've got team chaser coverage of a tough situation. It's the first time in our region that a baby was born with a birth defect related to the Zika virus. So, Alex, I know you were with the governor today, who had a lot to say about this issue and other things. But I want to start with Rohan. Rohan, you are outside of Hackensack Medical Center. What do you got?
Bill, I'm at Hackensack University Medical Center, where a mother gave birth to a baby on May 31st with complications linked to the Zika virus. The 31-year-old mother contracted the Zika virus in her native Honduras and traveled to visit family in New Jersey seeking better medical treatment. Now, the baby came out with characteristics of a Zika virus-born baby, such as microcephaly, an abnormally small head, and an underdeveloped brain. Dr. Abdullah Al-Khan gave us information on the health status of the mother.
We had a very high suspicion that the patient had a Zika-infected fetus. And our decision yesterday was to deliver her. She underwent an uncomplicated surgery, and she is trying her best to cope with this emotionally. And that's where we stand right now.
Now, the most important part that I gathered from the press conference was the issue of public safety. People are calling and asking questions if they should go outside, if they're pregnant, if they should go by the pool, if they're pregnant. The doctor stated clearly that neither the mother nor the daughter pose any type of threat to the general public. Now, these evaluations will continue as the mother and baby will be back here in Hackensack University Medical Center for the foreseeable future.
Yeah, well, our thoughts and prayers with the family for sure. Thanks, Rohan. Alex, you're with the governor today, who had some things to say about this issue with the Zika virus and the baby.
Governor Christie says that the state's preparedness plan is working, effective, and in place even after the baby infected with Zika complications was born at Hackensack Hospital. The governor says he's focused on prevention and has total confidence in the health department, and expressed his sympathies to the family of this baby.
Anything that affects a newborn child or any child is an awful tragedy, and so they have my sympathy and the sympathy and prayers of both my sympathy and prayers and Mary Pat's as well.
So is he not concerned that this thing could develop anywhere beyond this one woman having it and this baby being born with a defect?
I think his point is that they've already channeled their concern into productive action weeks before this baby was born, and the plan that's in place is going to hopefully last us through the summer months.
That wasn't only talked about, though.
The governor had a free-flowing, freewheeling press availability, including a follow-up about his trip to Washington, D.C. last week, where he encountered State Senator Loretta Weinberg on the Amtrak back from Washington, D.C. to New Jersey. I asked him, what was he doing in D.C.?
Last week, you were in Washington, D.C. You ran into Senator Loretta Weinberg on the way home. Why were you in D.C., and are you involved in the vetting for Donald Trump's VPs?
I'm not involved in vetting for Donald Trump's VPs, no. I'm the chairman of the transition. And I went to Washington for some meetings, which I'm more than permitted to do without either your permission or giving you notification.